Hello everyone, this is Dr. Fong and I am here today talking about glyphosate. And what do we do about this? How do we test for it? How do we lower our exposure to glyphosate in our environment, in our diet? And this is really a tricky one. I see this in a lot of my patients. I run environmental toxin panels a lot in my practice. And I do find this toxin very, very frequently. So what is it? Well, this is a pesticide or an herbicide that is used. It's actually a weed killer. It is used on crops and it is also used on non-crops. So like even your grass and your lawns, residential lawns. So you are potentially getting exposure through your food. You are potentially getting exposure through your environment as well too. So if you have a lawn in your home, do make sure that you're not using glyphosate. Another term for it is Roundup. So make sure that you are not using these harmful pesticides in your home. And then, one thing you can do is just make sure to eat organic. They did find a lot of glyphosate in beans and lentils and oats. And so, you can do your best to just make sure that you're eating organic for these crops that potentially could have glyphosate exposure, okay? So make sure, and in general, if you could just eat all organic, you will limit your exposure to not only glyphosate, but other pesticides. I do find other pesticides as well, pesticides and herbicides in my patients when doing environmental toxin panels. And this is something that I will do frequently for patients so that we can just uncover what you are getting exposed to in your environment. This can be done for patients of all ages, and this is something that can really just help us to understand, okay, what are you being exposed to, and do you need to do a better job of eating fully organic? Okay, so and glyphosate is one of those big ones, and they have done research in terms of what does glyphosate cause. And there are indications that glyphosate can lead to things like cancer. And I believe there was, a 40% increased cancer risk with that they've identified. And the International Agency for Research on Cancer actually categorizes glyphosate as a probable carcinogen for humans. And carcinogen means cancer causing, okay? And then there's also, there was a recent paper written said exposure to glyphosate-based herbicides and risk for non-hodgkin lymphoma, which is a type of cancer. Okay, so this is a big deal and something that we want to really understand in terms of what exposures we're having. So like I said, they have been finding, the FDA found extremely high and in some cases illegal levels of glyphosate on chickpeas, lentils, beans, and oats. So definitely for this particular toxin, you want to make sure that you are eating fully organic for all of those items. And then kind of furthermore, there are other pesticides that are found in non-organic food. So making sure that you know about the dirty dozen, making sure you are avoiding those foods on the dirty dozen. This kind of goes beyond glyphosate, but these are other pesticides that might be sprayed onto those crops, vegetables, etc. Those are things like strawberries and kale, I think, is in that list as well too. So making sure that you are eating all of those foods organic too, and you can get that list on EWG's website. And these are so important because these can really disrupt the system. As we talked about, they can potentially, they're linked to cancer. But then there's also other problems here too. This can really burden your liver and all of your detox pathways, and that would really affect your liver processes and your detox processes. And this can lead to other symptoms. So cancer is not the only problem here, but really putting a burden on those detox pathways can really lead to other symptoms. all of the symptoms that we experience. Some of the first symptoms that we experience when we have a congested liver and a congested detox, I call it a detox funnel, is we can first see a lot of skin symptoms. So in my practice, I treat a lot of skin disease. So we might see a lot of, eczema. We could potentially see psoriasis and acne. We can also see a lot of pain. So we might see joint pain and back pain and other types of pains that could actually be linked to your liver and your gallbladder and your detox funnel being really congested. The other problems that we see from there, we might see gut issues, constipation, we might see urinary issues, and then you keep going here, we might see, hormonal dysfunction, we might see headaches and migraines. And really when that, what I call the detox funnel, when that is congested and it's overflowing, you're going to have a whole list of symptoms that could occur. And unfortunately, in our conventional model, we don't necessarily look into, okay, what are these potential root cause issues? We are really just paying attention to, okay, what drug can we give to lower or silence what I like to call the alarm systems? All of those symptoms are really just alarm systems. So make sure that you are eating organic. And if you feel that you have had a lot of exposure, or if you feel like you have a lot of symptoms that are unexplained and you can't really figure out the root cause, it may be a good idea to do an environmental toxin panel. So the environmental toxin panel I like to do is a urine test. And I do sometimes like to give certain things to help draw out those toxins, and then they will spit out into the urine, and then you'll go ahead and collect that urine, and then we can see what spits out into the urine. So the environmental toxin panel, really great for understanding what your current exposures might be, especially if you have not thought about this so far. If you have not really cleaned up your environment, it'd be really interesting to see what environmental exposures you have. So glyphosate is covered in this test. Other pesticides are covered in this test. Other toxins include things like parabens, phthalates, which come from, those are plasticizers. Those come from fragrances and plastics. Other things are like exhaust fumes, the toxins from exhaust fumes in cars, and a lot of different toxins are covered in the environmental toxin panel. So something that's really great to do. Okay. If you are interested in doing an environmental toxin panel, that is available for people working with us in the Cleanbody program. And that's something that you can look into. You can check it out on our website at cleanbody.health. If you want to understand if your detox funnel is overflowing, then you can check out our free assessment. Go ahead to the link in my bio and click free assessment. And lastly, if you just want to learn more about, what the detox funnel is, how do you clean it out, how do you investigate with testing. This is one test that we're discussing today. I talk about this in my masterclass, and it is actually on demand. So right now you can access it at any time, and it's a 45-minute class. It's really power-packed. I really teach a lot about the detox funnel, how to clean it up, and then really get you looking at the root cause, because that's really what we need to pay attention to instead of just silencing the symptoms. Okay. So somebody did have a question. They asked about doing a gut test. And yes, gut tests are something I absolutely love to do as well too. Today, in today's IG Live, we're talking about environmental toxins, but a big part sometimes of why you might actually be accumulating toxins is actually your whole detox funnel process just isn't working well. And part of that detox funnel process is your gut. So if you are having gut symptoms, if you're having a lot of bloating, a lot of constipation, then it may be important to do a gut test. If you have a lot of food intolerances, food allergies, if you notice that you eat foods and you just have a big, inflammatory symptom after you eat, a certain type of food. And then if you notice that it's after almost every food you eat, even more so, we need to check out your gut. And so there are a couple of gut tests that I really like to do, and I really choose them according to what's going on with the patient. And I like to do tests that really do a comprehensive look. So if you go to your, kind of regular conventional doctor, you won't necessarily get this comprehensive test. You might get like a like a let's see what like a parasite test or a candida test, and they're really just looking for the bad bugs. If we do a gut test, we are looking for not only the bad bugs, but we're looking for the good bugs. We are also looking for a bunch of other bad bugs, not just like the main, like the C. diff and the candida and the H. pylori. We're actually looking for a number of different bad bugs. But the great thing is we're also looking at the good bugs here. We are also looking at gut function. So we're looking at, digestive enzymes. We're looking at, things like other factors that tell us whether you have leaky gut, whether you are digesting well, whether your toxins are getting detox through your gut. Okay, so really great tests, and those are things that we would need to assess individually from person to person. And you can look into booking a discovery consult with me. Booking a discovery consult with me, I'll kind of assess everything that's going on with you. In terms of labs, you can upload any labs you have from your doctor that you currently have. And then I will assess what other labs we might need to add as well too. If you are doing a blood test, anything that you should look at, well, I really like to do a very extensive set of labs. If you are going to book a discovery consult with me, just go ahead and get the tests that your doctor wants to order. And then if you want to do a discovery consult with me, I can check those out and let you know what additional tests we would do. There aren't, general tests that I order for every single person. Everyone really, I do a customized approach in terms of what tests we need to order, okay? Someone was asking about, yeast overgrowth. Yeast overgrowth will actually show up on these poop tests that we do. And that will be really helpful to understand if there is a microbiome imbalance and an overgrowth of yeast. Let's see, someone else was asking about being a hairdresser. Oh, if you are a hairdresser, you probably have a lot of exposure to environmental toxins. So doing an environmental toxin panel might be really important for someone who's a hairdresser. And then we may even want to still look at the gut because we want to make sure that you are releasing all those toxins out that you are getting exposed to in your salon. You do want to make sure to do everything you can possibly do to protect yourself, whether it be wearing a mask, wearing gloves, just making sure you're protecting yourself because you are exposed to a lot of chemicals, and then making sure you try to use, the cleanest products possible, not only for yourself, but also for your clients. It is important to also protect those around you as well too. Okay. All right, great. So you guys are welcome to type any other comments or questions in the chat box. I may have missed a couple. If I did, please go ahead and type it back into the comment box again, and I will make sure to answer that. But basically bottom line, make sure you are buying everything organic when possible. If you are having a lot of symptoms, I would recommend considering getting tested to just see what potential exposures you have. We could do a total toxic burden test where we check for environmental toxins, heavy metal toxins. We can look for mold toxins, another really common one. I'll do another IG live on that one. That's a whole IG live in itself. We can look for heavy metals, as I said, and all of these are potential root causes. They're potential disruptors in your system that are causing burden, okay? What are the pros and cons of dragon's blood? So I actually don't know what you're referring to in terms of dragon's blood. If you want to give me a little bit more information, I actually don't know what dragon's blood is. So if you wanted to give me a little more information, I can comment. So yes, so bottom line, eat organic, everything organic whenever you can. If you have a residential lawn, do not spray Roundup on there, using less toxic herbicides would be a better choice. And then getting tested so that you can understand what exposures that you might have. Yes, I do work a lot with children and babies, unfortunately, because our babies and our children have so much eczema when they come out. And part of that is their body screaming out that there are some burdens that are in their system, and then we need to uncover them. So yes, we can actually run these tests on toddlers and children as well too. Can an unhealthy gut cause vitamin D deficiency? So that's a good question. So vitamin D deficiency, number one, you have to go out in the sun in order to actually make vitamin D in your body. So if you are not going out in the sun 15 minutes a day, exposing your face, your arms, and your legs, you may not be getting enough sun exposure. Of course, during the winter, it might be a little harder. So you do want to make sure to get that sun exposure, earlier in the middle of a year when it's sunnier, and get that sun exposure, because you actually do bioaccumulate the vitamin D. You'll kind of hold on to it through the winter. So if you spend a lot of sun during the summer, you potentially should have enough vitamin D in your system during the winter to last you the winter time if you live in a cold area. But the other thing that needs to be working well for vitamin D to be in order is actually your liver. Your liver actually converts your vitamin D to the active version of vitamin D. So if your liver isn't working well, your liver is not going to make that conversion. So you might actually be getting a lot of sun exposure, but your liver is so congested and burdened that it's actually not converting your vitamin D to the active form of vitamin D. So I would say, more so than an unhealthy gut, I would like to probably, if you have a vitamin D deficiency and it's not getting better, taking vitamin D supplementation or going outside in the sun, then it may actually be more so your liver than the gut. However, there could also be an unhealthy gut that's linked to the unhealthy liver. So everything in your body works all together. We cannot separate any of these things, organ systems and other processes in the body that we tend to do in conventional medicine, okay? And by the way, nothing I say here is medical advice. This is all just kind of, I'm going to give you my clinical experience. If you, you do need to make sure you consult with your physician or consult with me. And if you want to consult with me, you could definitely book a discovery consult, and I can really assess what's happening and really give you those answers that are specifically for you, okay? How about Botox? Is that toxin to the body? Yes, so Botox itself is a botulinum toxin. It is a toxin. You are actually putting a toxin in your system, and absolutely it's something that your body's going to need to work through, right? And your body takes time to work through it. So, however long Botox lasts, which, you'll get Botox every, couple of months. However long it takes for that Botox to get out of your system, your body's actually metabolizing that and working through that toxin in that period of time. And so your body is getting a burden of that toxin during that time. So absolutely. I've actually treated people who, started Botox and then, it didn't happen immediately, but over time they were just kind of accumulating more burden on the system. And then they had, symptoms with getting a lot of Botox. And if we stop the Botox, then the symptoms would get better. But then these people wanted to do Botox. And by the way, there are some other ways of going about, an anti-aging regimen. I love things like red light therapy. You can also do things like PRP, which is an alternative to doing Botox. And then, of course, honestly, just being healthy, eating healthy, living healthy. I love infrared sauna for sweating and really getting the toxins out. And when you really think about what's aging you, not just age and not just time, which is, yes, that's one factor. But the other thing is we are accumulating toxins all the time. So the older we get, the more toxins we are going to accumulate. So if you really want to think about anti-aging and beauty and all of that, get those toxins out of your body. You will lose decades of your life in terms of the aging process by cleaning up your system and flushing out your detox funnel. So that's what we do best at Cleanbody. We really get that body so clean that it is really working in an optimal sense. And then, I love all those other natural ways of really promoting, the skin elasticity and the youth of the skin. Okay. If you want to take a look at some of my product recommendations, you can actually take a look at them. Go ahead and click the link in my bio. And I do have a link there for product recommendations. If you go to Skin and Beauty, you can see that I have a lot of things like red light therapy, blue light therapy. I have ice rollers and things like that to really promote the health of your skin from a natural perspective, rather than injecting yourself with certain toxins. Okay. All right. Well, it has been, it has been a pleasure. And, I am actually going to be doing, I'm going to call it a Doctor as Teacher series. So every week I'm going to teach a different topic. We are doing the toxin of the week. This week is glyphosate. So if you missed it, I will be posting this on my page, so you can take a look at this and just kind of learn a little bit more about glyphosate, how to avoid it, how to get tested, and how to clean it up. Okay. If you want to learn more, definitely check out my free masterclass. If you haven't done so already, it is on demand, so you can check it out at any time. It's 45 minutes of power-packed information. If you want to check out how full your detox funnel is, we do have an assessment as well too. All the links are in my bio. And if you do want to meet me, you can book a consultation. I can take a look at what's been going on with you. I can assess your health. I can let you know what labs we would want to do and how we would potentially address the root cause of your symptoms. Okay? All right, everyone. Have a great week, and I will see you next week. All right. Bye-bye.